Here we are again, we're back at a Q&A session with Barbara. These are inquiries that I typically get from my website, so if you do have questions yourself, please sign up to my newsletters and submit them. And so we'll kick off the first question, Barbara.
Okay. Jean wants to know what procedure addresses turned lip corners and volume loss.
Turned lip corners and volume loss. I'm presuming turned lip corners, are you referring to things that do this?
I would think they're down.
Downward, yeah. And volume loss, I presume, we don't know where that is, but it's not been specific enough. So we'll start to see changes where the corners of the mouth will turn down, and this can be through a combination of factors. Typically, we may see this particular muscle here, which is called the depressor angularis. That may become more powerful relative to the other muscles so that it pulls down. And if that's the case, again, through careful assessment, then you can use Botox injected here to lift that. But do be careful, because if you don't get that accuracy of that injection, it could actually make things worse. The other thing that you might start to see, typically as you get older, is that you'll start to see a lack of support in this area, typically with changes around the chin and the jaw and the anchoring around here, and back to some volume loss that may have occurred in the mid-face. And so if that's the case, or in combination with the Botox, you can use fillers to give that lift, to turn that corner of the mouth. And interestingly, we talked about temporal loss, I think, on the last Q&A. This temporal area actually does affect the corner of the mouth, so surprisingly. So again, if you're looking to restore some volume, particularly some lift, then you may have to consider that area as well.
Okay. Kathy is asking, I've been getting Botox for 15 years. Why is it less effective now?
So that's a good question, because I've been doing this myself for 20 odd years, and typically with my patients who are having Botox, I do less as we get older. And I think this is a common misconception. People think more wrinkles, more Botox. Let's be clear, Botox works on the muscles. So when you're younger and the muscles are stronger, you get a great benefit from using Botox. As we get older, there are other factors coming into play. So you have changes in the skin, changes in the fat, changes in the bone. And in fact, the muscles themselves become weaker. So in fact, as you get older, you should really be reducing the amount of Botox that you are you're using, and start to really consider other things to address those folds and those wrinkles. And I suspect this is possibly why she's referring to the Botox not working as well as it used to.
Probably. Stephanie wants to know the best solution for nasolabial folds. She feels that hers are very prominent for someone in her early 20s. What's causing this? Is it structural issues in the cheeks? What would be the best course of action to improve her appearance?
So nasolabial folds, these folds that we see here, are typical, usually the first signs of aging that we will see, where we may have descent of tissue and volume loss, and presenting typically with this fold. And actually, I do see this in younger patients as well. I treated one today, in fact. So if that's the case, again, it's a simple fix in terms of really doing a very strategic placement of filler here in the mid-face to lift. The danger, of course, is that if you don't know what's going on, you might be tempted to fill this area, as was certainly done in the past, and put filler here, which will tend to make you look like a chipmunk, or will tend to I've seen it sort of, the filler, if you put too much there, will move like a sausage. So again, you really want to look at what's the cause here, and you really want to put in something that was going to lift and not give necessarily volume itself.
Okay. Diane says she has sagging and extra fat around her mouth and mid-jaw, and it's very unflattering. Any recommendations for treating these areas, the mouth and mid-jaw?
So I think that what she's referring to is what we call jowls. So we're typically looking at this mid-face and around the mouth.
Yeah.
And this again is a result of tissue descending, soft tissue descending, and typically we're losing support of the pre-jowl and the post-jowl, which is really the chin and the angle of the mandible. But we're also losing the support from the mid-face. So again, this is probably the number one thing that I'm treating most of the time, which is the challenge, is what we call the sort of lower third. And really you're going to have to think at a more planned approach to treating this area that will typically involve, most of the time will involve fillers through lifting, through chin, perhaps strengthening or projection, and through jaw contouring and strengthening around the angle of the jaw, so that you're kind of doing this rather than something that's occurring like that. But you also want to get that lift at the same time.
Okay. Danielle is 42 years old and wants to add fillers to have a more youthful look. She has a good skincare routine, but feels that her face is flat. Where can I add some volume? I could really understand this question. You have a lot of young patients her age. Well, young, 42 is, not a teenager, but that is, in my book, it's considered young. I get a lot of women in their 40s are starting to look at their faces and starting to be a little critical. They feel that they're really taking care of their skin, they're doing everything they're supposed to be doing, but they still need a boost, a lift of some sort. That's what Danielle sounds like she needs.
Well, I mean, this is probably, we've talked a lot in all of these sessions really about what I call mid-face volumization and lift, and this is really, that's another question about that. So yeah, I mean, as we're getting older, we're losing some volume typically from the fat pads and the fat layers, but there's other things going on. The retaining ligaments, the muscle fibers are not so supportive, so everything starts to descend. We're losing support in various areas as well, so we're getting folds that develop, jowls and this kind of stuff. We're back to what we call the modified facelift, whether it be 5-point or 8-point, and really a lot of the work is to lift the area, and sometimes it doesn't need to be that much. It may be also that you need to look at the skin itself. You may want to plump this up. You might want it to want to restore some of the elasticity that you've lost in the skin. So a good skincare regime is important. It sounds like she's on that, but these are other things to consider. And then of course you're looking really at a global approach, a holistic approach to the face, in terms of, you can think of other things like the microneedling, the light therapies that we use as well for anti-aging, the red light therapies, for example. Botox, of course, we use a lot, particularly in the upper half of the face, to lift or to prevent wrinkle correction, wrinkle formation around the eyes. So typically a combined approach is usually what we're doing at the end of the day. But again, a very careful assessment. Everyone's very different. and everyone has a different treatment plan, if you like. So go and see someone that knows what they're talking about, who's had some experience, and there's usually more than one option. And I think a lot of these are best also planned. So you're not getting it all done in one go. It may be doing, you're doing it in a few sessions, and then you'll maintain that by possibly seeing the practitioner once or twice a year.
I think Danielle just feels she looks tired. She looks in the mirror and she doesn't see any zest in her face. I think she just needs to make an appointment, have a consultation, and allow the aesthetic doctor tell her what the options could be.
Yeah, I mean, when we're looking at patients and listening to them is very important, because they give the clues as well. If someone's looking tired, we tend to look at the eyes or the mouth for that. If they're looking sad, for example, we'll tend to look at this sort of area here. If they're looking angry, we'll tend to look at this area. So what we call emotional attributes and listening to the patient is very important. And obviously understanding, the various anatomical units around the face that will give rise to these problems.
Okay, that's it.
That's it for the
All
day.
our questions.
So please reach out through my website to submit any questions that you may have, and we'll pick those up at the next Q&A session. Thank you.